Margaret thought she was doing everything right. Annual cancer screenings? Check. Bone density tests? Check. Full body scans? Absolutely. She was 67 and determined to stay healthy. Then came the cascade. An unclear mammogram led to a biopsy. A routine thyroid check found a tiny nodule. Suddenly, she was juggling appointments, procedures, and mounting anxiety, all for things that would likely never have affected her health. Here's what her doctor told her. Some of those tests might actually be doing more harm than good. Quick question before we dive in. Have you ever felt pushed into a medical test you weren't sure you needed? Keep that thought. Because today, we're revealing the 5 checkups that leading medical organizations, including the American Geriatrics Society and the U.S. Preventive Services Task Force, now say many people over 65 should reconsider or skip entirely. And no, this isn't about cutting corners on your health. This is about protecting it. Let me guess. You've been told more testing is always better, right? That catching everything early is the golden rule of health? For decades, that was the mantra. But here's what they didn't tell us. The American Geriatrics Society now recognizes that after 65, our bodies work differently, our priorities shift, and aggressive screening can sometimes create problems that wouldn't have existed otherwise. In fact, studies published in JAMA Internal Medicine found that up to 30% of screenings in older adults may lead to unnecessary procedures, false alarms, or treatments that reduce quality of life without extending it. That's nearly 1 in 3 tests causing more stress than solutions. And let's be honest, we've earned the right to spend less time in waiting rooms and more time actually living, haven't we? So here's what we're uncovering today. 5 common health checkups that might not be serving you as well as you think after 65. 1. A cancer screening that sounds essential but can lead to overtreatment and serious complications for many women in their late 60s and beyond. 2. A test for a silent disease that often creates unnecessary fear and interventions, especially if you are already healthy and active. 3. A scan that's heavily marketed as life-saving, but has a staggering false positive rate that can spiral into invasive procedures. 4. A routine check that almost every doctor orders, but might be doing absolutely nothing to protect your heart while causing a whole lot of worry. 5. And the last one? It's considered the gold standard of prevention by many. Yet, major medical societies now say it might actually shorten your life in certain situations rather than extend it. Now, I know what you might be thinking. Wait, aren't these tests supposed to save lives? Sometimes yes. But after 65, the equation changes. Your life expectancy, existing health conditions, and risk of complications from unnecessary treatments all factor in. Before we reveal number 1, pause for just a second. Are you ready to challenge what you've been told about routine checkups? Because this might surprise you. Let's start with the one that affects millions of women every year. Checkup number 1, routine mammograms after 75. Let me start by saying this clearly. Mammograms have saved countless lives. They are incredibly valuable for many women. But here's where it gets complicated after a certain age. The U.S. Preventive Services Task Force found that for women over 75 or those with a life expectancy under 10 years, routine mammograms often detect very slow-growing cancers that would never become life-threatening. Think about it this way. Breast cancer found in your mid-70s often grows so slowly that something else, heart disease, another condition, would likely occur first. But finding it sets off a chain reaction: biopsies, possible surgery, radiation, medication side effects. Studies show that for every 1,000 women over 75 screened annually for 10 years, only 0 to 1 deaths from breast cancer is prevented. But up to 200 women will experience false alarms requiring additional testing. That's 200 women enduring anxiety, biopsies, and potential complications for minimal benefit. Here's what to do right now. Schedule a conversation with your doctor about your individual risk factors. Ask these specific questions. Given my overall health and life expectancy, what's the actual benefit of continuing mammograms for me? What's my personal risk of breast cancer versus the risk of complications from treatment? If you have a strong family history or genetic markers like BRCA mutations, the equation changes completely. You may absolutely need continued screening. But if you're generally healthy with no special risk factors, the American Cancer Society now says the decision to continue screening after 75 should be individualized, not automatic. Checkup number 2, routine bone density scans. Osteoporosis screening. It sounds like a no-brainer, right? Catch bone loss early, prevent fractures. But here's the twist. One baseline scan is valuable. Repeated scans every year or two, often not necessary and potentially misleading. The U.S. Preventive Services Task Force recommends bone density screening for women 65 and older. But for most women with normal or mildly low bone density, repeating the test more frequently than every 5 to 10 years provides little additional benefit. Why? Bone density changes slowly. Very slowly. Annual testing often shows changes that are within normal measurement variation, not true bone loss. But those results can trigger unnecessary treatments with real side effects. Take Linda, 68. Her first bone density scan showed mild osteopenia, lower than normal but not osteoporosis. Her doctor wanted yearly scans. After 3 years of slight variations, she was put on medication that caused digestive issues and jaw problems. Yet her actual fracture risk had barely changed. When she got a second opinion, the specialist said, "Your bone density is stable. These medications carry risks. Let's focus on weight-bearing exercise and calcium-rich foods instead." Quick self-check. Stand up and try standing on one foot for 10 seconds. Can you do it without wobbling or grabbing something? Balance and muscle strength are often better predictors of fracture risk than bone density numbers alone. If you can maintain good balance, stay active, and haven't had fractures, aggressive bone density monitoring might not be necessary. Instead of frequent scans, focus on weight-bearing exercises 3 to 4 times per week, walking, dancing, light weights, getting adequate vitamin D, 2,000 IU daily for most people over 65, reviewing medications that might affect bone health with your pharmacist. Ask your doctor, given my initial scan results and lack of fractures, how often do I truly need repeat testing? Checkup number 3, full body CT scans or executive health screenings. These sound incredible, don't they? One scan, your whole body, find anything lurking before it's a problem. Some companies market them as the ultimate preventive health tool. But here's what they don't advertise. The false positive rate is staggering. Studies published in JAMA Internal Medicine found that full-body CT scans in asymptomatic individuals detect abnormalities in up to 86% of patients, but the vast majority are benign, clinically insignificant findings that lead to unnecessary follow-up tests, biopsies, and surgeries. That's 86 out of 100 people getting scary news about something that will never harm them. And there's more. These scans expose you to significant radiation, equivalent to hundreds of chest x-rays. That radiation itself carries cancer risk, especially with repeated scans. Doctors even have a name for this: incidentalomas, findings discovered by accident that create a cascade of medical interventions. A small kidney lesion that would never grow, a tiny lung nodule that's been there for years, a liver spot that's completely benign. But once found, they must be investigated. More scans, biopsies, anxiety, medical bills, time away from actually living. Think about someone you know who had a health scare that turned out to be nothing. How much stress and disruption did that investigation cause before the all clear? Here's what major medical organizations recommend instead. Evidence-based screenings only. Colonoscopy, skin checks, blood pressure monitoring. Symptom-based imaging. If something's actually wrong, scan for that specific concern. And regular check-ins with a primary care doctor who knows your history. The American College of Physicians explicitly advises against whole-body screening scans for asymptomatic adults. Save your money and your peace of mind. Still with me? Good. Because these next two might be the most controversial and potentially the most important to understand. Checkup number 4, routine EKG screening. An EKG, electrocardiogram, feels like such a simple, harmless test. It takes 5 minutes, doesn't hurt, seems like smart prevention. But here's what research shows. For healthy adults with no symptoms and no heart disease risk factors, routine EKG screening doesn't save lives, but it does lead to unnecessary downstream testing. The U.S. Preventive Services Task Force reviewed extensive evidence and concluded that for low-risk, asymptomatic adults, routine EKG screening provides no net benefit and can result in false positives that trigger stress tests, imaging, and even invasive procedures like cardiac catheterization. Let me translate that. If your heart feels fine, you have normal blood pressure, no chest pain, no family history of early heart disease, and you're reasonably active, a screening EKG might find a blip that looks weird but isn't dangerous. Then comes a stress test, maybe a CT angiogram with contrast dye, which has kidney risks, maybe a catheterization, which has a small but real risk of heart attack, stroke, or bleeding. All to investigate something that was never going to hurt you. Remember Margaret from the beginning? Her routine EKG showed an irregularity. It led to 3 more tests over 6 weeks, significant anxiety, and ultimately the cardiologist said, "This is a normal variant. Your heart is fine." 6 weeks of worry over a normal heart. Here's what actually protects your heart after 65. Know your numbers. Blood pressure, cholesterol, blood sugar. Move regularly. 150 minutes of moderate activity weekly. That's just 20 minutes daily. Manage stress. Chronic stress is a massive heart risk factor. Stay socially connected. Loneliness increases heart disease risk by 30%. If you have symptoms, chest pain, unexplained shortness of breath, palpitations, dizziness, absolutely get an EKG. That's diagnostic testing, not screening. But routine EKGs for healthy, asymptomatic people over 65, the evidence says skip it. Quick reality check. Are you getting tests because you have actual symptoms and concerns, or because it's on the list of routine screenings. There's a big difference. Checkup number 5, annual screening colonoscopy after 75. Okay, this is the big one. The screening that's been drilled into us as absolutely essential. And I want to be crystal clear. Colonoscopy screening is one of the most effective cancer prevention tools we have. But, and this is critical, timing matters. Multiple major medical societies, including the American Cancer Society and the U.S. Preventive Services Task Force, now recommend stopping routine colorectal cancer screening at age 75 for most people, and definitely by age 85. Why? 3 key reasons. First, the timeline issue. Colorectal cancer typically takes 10 to 15 years to develop from a polyp. If you're 78 and had clear colonoscopies before, the likelihood of developing life-threatening colon cancer before other health conditions become more pressing is quite low. Second, the risk to benefit ratio shifts. Colonoscopy complications, perforation, bleeding, adverse reactions to sedation increase with age. Research in the Annals of Internal Medicine found that colonoscopy complications in adults over 75 occur at rates 2 to 3 times higher than in younger adults. That means for every 1,000 people over 75 getting a screening colonoscopy, 10 to 30 will experience a complication requiring hospitalization. Third, life expectancy matters. This isn't ageist, it's realistic medicine. If you have other significant health conditions, advanced heart disease, COPD, dementia, aggressive cancer screening may not align with your goals for quality of life. You might still need colonoscopy if you've never been screened before. A catch-up screening can still be valuable into your mid-70s. You have a personal history of polyps or colon cancer. You have inflammatory bowel disease. You have strong family history of colon cancer. Or you're experiencing symptoms like blood in your stool, unexplained weight loss, persistent changes in bowel habits. Rupert, 76, had colonoscopies every 5 years since age 50. All clear. His doctor suggested stopping. Robert was hesitant. Wasn't this risky? His gastroenterologist explained, "You've had 6 clear colonoscopies. Your lifetime risk of colon cancer is now very low. The risk of complications from the procedure itself is starting to outweigh the benefit." Robert decided to stop routine screening and focus on symptoms instead. 3 years later, he's healthy, active, and grateful he's not spending time on procedures he didn't need. Here's a powerful question to ask your doctor. Given my screening history and overall health, what specific benefit would another colonoscopy provide at this point in my life? If they can't give you a clear, individualized answer, just, it's routine, dig deeper. Your action plan. Review your screening history. When was your last colonoscopy? What were the results? Assess your health status. Life expectancy, other conditions, quality of life priorities. Have the conversation. Ask about non-invasive alternatives like stool-based tests, FIT or Cologuard, if screening is still recommended but you want less invasive options. Document your decision. Make sure your preferences are clear in your medical records. Here's what nobody talks about. The goal of healthcare after 65 isn't just to add years to your life. It's to add life to your years. Sometimes the most powerful health decision is knowing when to say, this test isn't serving my well-being anymore. Imagine this. You wake up tomorrow And instead of anxiety about the next round of tests, you feel clear, confident, in control. You've had an honest conversation with your doctor about which screenings truly serve you at this stage of life, not just what's standard protocol. You're spending less time in medical offices and more time doing what matters. Gardening without worry, traveling without interruption, playing with your grandchildren without wondering if you should be getting just one more scan. You understand that protecting your health isn't about doing every test possible. It's about doing the right tests at the right time for your unique situation. After learning this information, my friend Susan, 72, sat down with her doctor and reviewed her entire screening schedule. They eliminated 3 tests that weren't benefiting her and reallocated that time and energy to physical therapy for her knees and a nutrition consultation. 6 months later, she's hiking again. Her knee pain has improved dramatically, and she told me, "I feel like I got my life back. I'm managing my health, not letting tests manage me." Take a breath. Think about your last year of medical appointments. How many were truly necessary? How many left you more anxious than informed? What would it feel like to approach your health with clarity instead of fear? Listen, I know this might feel uncomfortable. We've been taught that good patients follow all the rules, do all the tests, never question the system. But here's the truth. The best patients are informed partners in their care. So here's what I want you to do right now. First, save this video. You will want to reference it before your next doctor's appointment. Second, share this with someone you love who's navigating healthcare in their 60s, 70s, or beyond. This information could literally change their quality of life. Third, leave a comment below. Tell me, have you ever felt pressured into a test you weren't sure you needed? Or did you skip a screening and feel guilty about it? Let's start an honest conversation. And if you want more straight talk health information that actually serves women in this stage of life, not just what everyone else is doing, hit that subscribe button. We are building a community of women who are rewriting the rules on aging with wisdom and strength. This channel isn't just about health tips. It's about taking back control of our well-being and supporting each other in making informed choices. Remember, menopause and the years beyond aren't about declining. They're about refining. Refining what serves you. Refining how you protect your health. Refining your priorities so you can actually live well, not just avoid every possible risk. You've earned the right to ask questions, challenge assumptions, and make healthcare work for your life. Now go have that conversation with your doctor. You've got this.